Hello, my name is Charles Posky. I'm a nursing student here at South Alabama. And today I'll be continuing the nasogastric tube placement. I'm going to have my friend recording scan the room. As he's scanning the room, I'm explaining that from the previous video, I already have my Don goggles on. I've already have clean gloves on. I verified the order and the hospital policy. So now the only thing I have to do is to begin my tubing. So I'm going to grab my tube. It's coiled up and I'm going to release it. And then I already have a double of wet soluble lubricant, and I'm going to lubricant the first 4 inches of the tube. And before the tube goes into the nair, I'm going to tell the patient to put his head back against the pillow so I can insert it. So once I'm inserting it through the nairs, once I get past the nasopharynx, I'm going to tell the patient to flex his head forward. I'm going to tell the patient to relax. I'm going to then tell the patient to dry swallow as I enter through his nares and drink water. I'm also going to, as I'm entering, I'm gonna go through 1 to 2 inches while rotating at 180 degrees. If the patient starts to cough or oxygen saturation starts to deplenish and has respiratory distress, I'm going to stop the procedure and I'm going to pull the tubing back up to the posterior nasopharynx until the patient's respiratory becomes regular again. After so, I'm going to tell the patient to dry swallow so I can then advance my tubing back down to his nares. After I get down to the nares, if I ever reach resistance, I'm not going to push against it, but for right now, I'm just going to 1 to 2 inches at 100-degree angles until I get to my place marker right here. I'm then going to hold down to that spot. I'm going to grab my temporary tape. I'm going to tape it on his cheek to keep in place. And then I'm going to use my pen light and tongue blade to check the placement in the back of the throat. As doing so, I'm going to also put in my 60 milliliter syringe into my tubing. As I'm checking for placement for the tubing, I'm looking for aspirating gastric content. I'm also looking for pH levels if indicated and x-rays if needed. After that, I'm going to remove my temporary tape and put on my final tape. Onto the nose like so. After I place the final tape on there, I'm also going to clip the NG tube to the gown so the patient can maneuver his head left and right because of for the hospital policies. And then after that, I'm going to mark the tube on the nose to see if there's going to be any displacement of the tubing. Next, I'm going to demonstrate suctioning. So first what I'm going to do is for suctioning, I'm going to remove this and I'm going to place this into the suctioner. I'm going to suction it to a low wall, intermediate suctioning. And then after that, I'm going to demonstrate the non-suctioning, where I'll put the blue pigtails, the Salem septum above the Salem sump above the patient's stomach, like so. And then after that, I'm going to raise the side rails, lower the bed, make sure the call light's in reach, make sure the patient's in a comfortable position. And then I'm going to, after that, I'm going to make sure that the bed does not lower below 30-degree angle. Next, I'm going to remove my supplies, remove my towel, and I'm going to perform hand hygiene, and then I'm going to document the assessment. So I'm going to document the type and size of the NG tube. I'm going to also, for time, location, how secured it was, the verified placement of the tube, I'm also going to be looking for the suctioning, patient's tolerance, amount, color, and characteristics of secretions. After that, I'm going to start to remove the NG tube. I'm going to displace it, and then after I'm doing that, I'm going to verify the order. I'm going to explain the procedure to the patient, what I'm going to be doing, and I'm going to perform hand hygiene, and then I'm going to don clean gloves. As I don clean gloves, I'm going to auscultate bowel sounds. I'm going to turn off the suctioning, and then I'm going to remove the tape of I'm going to remove the tape from the skin, and I'm also going to remove the clip from the gown. As I'm doing that, I'm going to tell the patient to hold its breath, and I'm going to gently pull it out. Oh, and then before I gently pull it out, I'm going to kink it so so nothing comes out. So as I kink it, I'm going to pull it out gently. And I'm going to remove it, and then after I remove it, I'm going to measure the amount of drainage. I'm also going to perform oral hygiene, and then I'm going to document, and that would be the end of this assessment.